Hi, we're here with Don Nutbeam, Professor of Public Health at the University of Sydney. So we've collated some questions from our delegates today, and Don, the first kind of question we got here was, what do you think are the next big research questions in health literacy?
Yeah, my own view is that we've probably indulged ourselves a bit in describing the problem, and for me, the biggest challenges we face going forward are very much to do with conducting intervention research, coming up with practical solutions to what we know to be a significant problem and what we know to be a problem that's unevenly distributed across the population. If we can't come up with practical answers, then I think we're going to stumble. And so, for me, I'd give greatest priority to conducting practical intervention research in different settings, using different media, and aspiring to developing people's skills across the spectrum of functional through to critical health literacy, developing in health professionals the skills they need to be better communicators, and recognising, of course, that the environment, the way health services, for example, are organised also impact. We need to understand how to change people, change the professions, change the environment. And if we're not researching in those areas, then I think we're going to run into a cul-de-sac, basically. Thank you.
Now, you were instrumental in developing the concept of health literacy and how it's developed in the way, has it developed in the way that you envisaged it would?
Yeah, I'd love to tell you I had an idea about how things might develop. All of my life experience, though, is that things develop in uneven ways, and we have to be opportunistic in making the most of the interest that currently exists in health literacy. I'm certain eventually some of that interest will dissipate, but right now we have a really outstanding opportunity across many countries in the world to promote health literacy as a policy instrument, as a strategy, and as something that will ultimately deliver better outcomes for people in their communities.
Okay. And do you think that critical health literacy has really came about, if you like, in the way that you envisaged?
Yeah, I think the idea of critical literacy has existed for a very long time. I must admit, when I was doing my master's studies a very long time ago, I was very interested in the work of Paulo Freire and his critical consciousness raising ideas. So it's not like that's a new idea. It's just that idea applied to health. I think it's harder, both conceptually and in practical terms, to support people in the development of critical literacy. And as a consequence, I think there are many fewer research studies and practical projects that aspire to raise critical consciousness about health. And I suppose I'd link back to a comment I made earlier that it's only going to be through further practical experimentation and through further research that will really develop the idea. But for now, for most people, particularly those who are working in healthcare systems, it's easier to relate to functional health literacy and interactive health literacy, and that's where the bulk of activity and the bulk of research is currently concentrated.
Thank you. Is there space within kind of action plans for health literacy to address at a community rather than just an individual level? And what do you think that would be?
I'm not sure if I completely understand what community health literacy means. I have a view that we improve health literacy in populations by taking action that benefits individuals, by bringing about change in the environment to make it more sensitive to the health literacy challenges that the environment can create, and by working with those involved in communicating with members of communities, whether that's doctors and nurses or pharmacists or working with the mass media or using digital media platforms to communicate. And you know, whether you can argue for a collective added value, a community health literacy, I'm personally not terribly convinced about it, but I know other people feel this is a good concept, and I would encourage them to research it and help explain it more, but not something that's really on my radar, to be honest.
Okay. What do you think are the biggest kind of challenges in health literacy, or the best opportunities that we have at the moment?
Yeah, certainly some of the challenges are that I think we've won the argument that this is an important issue, that governments and health systems need to take account of it, but we're struggling with the next sentence. And this is what you should do. And so for me, one of the risks is that we win the argument and then fail to capitalise on winning the argument, because we're not coming through with clear advice on what we would expect governments, health systems, schools, communities, it's what we would want them to do that will actually improve health literacy in populations and reduce the literacy burden. So for me, I'm back to the same argument. We need to focus our attention on what it is that we need to do that's going to practically change things.
And you touched a little bit there on the kind of digital platforms, and if you like, how do you kind of envisage that these social digital platforms can be used?
Yeah, so there's no doubt in my mind that digital platforms, digital communication in different forms will become increasingly important. I'll be very honest with you, though, that my experience that there's an app for everything can be a distraction. And at this point in our evolution, those least likely to be using digital platforms are often those that we most need to communicate with. And as we advance our use of digital platforms, which we must, we just need to be mindful of the fact that they're not the only answer. And they are, without question, a really powerful tool. But we're trying to operate in a crowded marketplace. And we're not always reaching the people that we'd most like to reach using the digital platforms that we like to use. So it's no doubt that it's part of the future, an important part of the future. Just a slight warning that we need to be thoughtful about who we're trying to reach and for what purpose, and then ask the question, is a digital platform right for that purpose, rather than starting with, I've got a digital platform, how can I use it?
Absolutely. So not the technology leading, more of the actual reason for using it. And I suppose in digital platforms as well, I'm kind of thinking more of the social digital platforms and maybe the individual ones as well. The use of those, but same kind of points, I suppose.
Yeah, it's all about what is it we're trying to achieve first, and then is there a digital platform that can assist us in achieving that? And as long as the questions are asked that way around, then I think we're fine.
Okay, well, thank you very much for taking the time to speak to us.